Welcome back to a Wise Mind podcast presented by Sabino Recovery. My name's Sam Zimmer. I am your host, and today it's my pleasure to introduce and welcome Vicki Lawyer. She's the president and CEO of Blue Door Psychotherapy here in Tucson, and they specialize in DBT and family therapy. Welcome, Vicki. How are you?
Thank you, Sam. I'm doing well. How are you?
I'm doing well. I'm very excited that we're able to have you here today because this topic is just something that's so important for, people who are going to treatment and just, anyone who's going through crisis when it comes to substance abuse, mental health, any type of recovery really, because the family connection and that process and how it takes place is so important.
I agree.
So why don't you just go ahead and get started? Tell us a little bit about yourself. Why is this work so near and dear to you, and how did you kind of get started on the route that you're on right now?
Okay. Yeah, well, I started out as a professor.
Okay.
So I started out studying families and looking at the research. And what I found is that there was a real gap between the research and then the applied and what really happens. And that became more important to me after the birth of my first daughter. I was a professor and I was the chair of the Northeast Council on Youth at Risk. And shortly after she was born, I was doing a conference keynote and saying the most important thing in families is time with your children. And at 6 weeks old, my child was not with me. So I started training in family therapy to make a transition into applied work. And I worked with Marianne Walters in D.C. for the Family Therapy Practice Center. And she was just a real go-getter. She was a feminist at a time when we were blaming moms for everything. She worked with Salvador Minuchin at the Philadelphia Child Guidance Clinic and came away leading the Women's Project in family therapy, saying that even though it takes two to tango, if one is to lead and the other to follow, they're not equal parts.
Mm-hmm.
So working with her, the focus was on very chaotic families and moving away from pathology and into increasing their family strengths. And I just love that because I think most families have times when they need help, and it doesn't mean that they're sick, and it doesn't mean that they're broken. It just means that life is tough.
Yeah.
And she just had a wonderful way of looking at what people were doing and just expanding what they were doing well, as opposed to trying to teach them all to be one model.
Right. Yeah, no, I think that's a model that's a lot of people in different industries, what the approach is to focus and improve your strengths rather than to focus on the weaknesses. So it's interesting that even in this kind of field that's also consistent. So why is that so important? When somebody is going through crisis, I think a lot of times people think that, the problem is just with that individual, right? It's this person who's drinking too much or doing drugs or, is depressed and anxious or whatever the case may be. And, a lot of people just think the family's just kind of there in the background to support quietly, but really they have a more central role, or they should, right?
Absolutely. And what we know about families is that they are small groups with more emotional intensity than any other small group. So there's an increased chance for love and connection and also for abuse and difficult things. So that small group is really important. People recover better in the context of a small group and in the context of a family group than they do without a supportive family. And when you look at issues like stress, heart attacks, stroke, that sort of thing, those happen to family members of people who are ill or addicted more often than the ill or addicted member.
Oh, right.
So families end up being in sync with each other, right? So if we don't treat the family, we can't really treat the individual.
Mm-hmm.
And if we don't treat the family, we don't have a nice, solid part of our community to support other parts of the community.
Right. And by the same token, I can kind of see where this is going. So that was a great example with somebody who has a heart attack. Maybe it's because there's a high stress environment at home with their family, similar to somebody who turns to drugs or alcohol.
Yes.
Maybe there are some triggers that the family is presenting at home that if it weren't for them, this person would have never turned to these substances or, maladaptive coping mechanisms.
Yeah. I mean, there's just so many reasons why people might turn to drugs and alcohol. And some of it, if you look at the psychobiological approach, right, some of it is strictly biology, right? That there's going to be something that the brain is going to grab onto that's addictive. That center part of their brain highlights.
Of course.
Sometimes it's the social part that those family members typically turn to something else to soothe rather than to resolve things between themselves.
Mm-hmm.
So there could be anxiety. There could be all kinds of things that are going on.
So I've been through my own therapy on an individual basis, and I know that there are certain types of modalities that work well in that setting. When it comes to family therapy, are there any different types of, therapies or modalities that are often used or are more effective with like a group in a family setting?
Yeah, and so it really depends on what's going on with the family, right? So if there's a lot of chaos, or if there's an addiction, if there's something like that, a structural therapy is generally the most effective because it creates the most relief early on.
Okay.
So if you think about starting with that behavior piece, helping people know who's in charge of what, who's on what lane, and how to keep their own lane clean, those are the most effective initial parts of family therapy. When you're looking at addiction, the idea is that the family system as it is has to collapse and then reorganize so it's more helpful. So many of the things that families do that seem to be helpful early on in a crisis end up being part of the problem later on.
Mm-hmm.
And so you really want to give people permission to relook at the situation. So there's some structural, strategic, and communications theory that you package together in that case. If you have people without any other problem-saturated situation, then you can go to a communications theory or something that increases vulnerability. But when you have crisis, you want to stay away from the vulnerability and into the predictability.
Right. Yeah. No, that reminds me of, my mom when I was first getting into treatment. She did a lot of things that she thought were the right thing just because she was panicking and she loved me so much. And it became clear later on that maybe some of those things were not part of the problem, but weren't helping anyone solve the problem, I would say. Yeah. Yeah.
Absolutely. And, if you look at how moms are socialized, and this was part of Marianne Walters' work. So I use a competency-focused approach, which was the approach that she developed.
Okay.
And at that time, we were blaming people, calling them enablers, calling them codependents and all that. And she was like, that's ridiculous. These are people doing their caring function very, very well. They're attached to these people, and they're seeing people walk away from them. So, of course, what do you expect then for them to increase their functioning? What she would do is she would help people see how now the solution to the problem is becoming the problem. Mm-hmm. And that's also some of Jay Haley's work for strategic as well. And that's what she did, is she took the stronger models and really put them together, but in a very respectful way.
Mm-hmm.
So moms for a long time got blamed. Families for a long time got blamed. They're being codependent. And when you start looking at what happens as families start shifting, first, you're going to get attachment reactions, right? Crying, clinging, and protest.
Mm-hmm.
And if you look at the family member of somebody who's ill or addicted, they're unreasonable and irrational. Well, those fit together.
Right.
Right? So your first thing is to calm the fears. Because once you start calming the fears, some of the behavioral problems to those fears start becoming more manageable.
Okay. Yeah.
Right? So the other thing to look at is how families are complementary, right? And if you think about yourself dancing on a dance floor and you start off in one place and you end up on a part that you didn't expect yourself to be, and then you might walk back to where you started, but then you end back in the place because you're following each other. And when one member is ill or addicted, or there's ambiguity of what's going on, people try to get in sync with each other and they end up in the wrong place. So the piece for families to be aware of is what is the disease, what is happening, try to clarify it as much as they can so that then they can be prepared for what is more helpful.
Right. And we were talking about this a little bit before we started recording, and I really like that analogy of dancing right on the dance floor. And you were saying that the unhealthy side of that is the afflicted family member, the person who's in their active addiction, is the one leading the dance, and the loved one is the one following or chasing them. But what you in your practice and your work strive to get back towards is, the mother or the wife, whoever is the one in the supportive role to that person who's been afflicted with these problems. They should be the ones kind of coached up to lead the dance back to their area. Is that what you're saying? Yeah.
And there's so many parts of that, right? Mm-hmm. Because there's so many different places where they feel invalidated. Like nobody gets what's going on. And so when you get invalidation, you also get the other half of it becomes a power and control move of who's going to get heard more. Right. And so when you can validate the family members that it is that scary and they may lose their loved one, and there really is nothing that they can do to correct the loved one's behavior. So you're working a lot with the unrelenting crisis and the inhibited grief that DBT talks about. Right. So dialectical behavioral therapy does a really great job with family systems that are invalidating. Mm-hmm. And in that situation, our first thing is to validate families and what they're going through and their loved one, right? Because when you get down to it, we have an impasse. Can you tolerate being in a family where addiction is not a possibility? And can you tolerate being the family of somebody who's addicted? Right? So that's the impasse. And for the family members, coaching them to keep this a solid, connected experience so that when their loved one does come back, they have a soft place to land. Right. Yeah. No, I can see how that's so important because, if they don't have that strong support system when they get back, then it's just going to be, the same record, keep playing, And I think that's something that we definitely try to do here at Sabino, and I think we're very successful with our 4-day family program in the 4th week of somebody's stay here so that, that family can start to realize if they haven't already, because another thing we really suggest is that the family gets some kind of outside help earlier on from the get-go when somebody comes to Sabino so that they can start to realize what are some of those changes that need to be made at home, if any, right? If any, there's always at least a few that would be helpful for that person. But then, having the opportunity for them to actually come here and kind of lay out the groundwork of how things are going to look when, the husband, the son, the daughter come back home so that everyone's on the same page and confident in the plan. Yeah. And as you were talking about that, I was thinking, a lot of times when we see people, just before we refer them here, we'll notice the pattern. And so sometimes the family's not even articulating, because remember, it's an ambiguous loss. Mm-hmm. One of the things about addiction and disorders like that is that there's a big component of hiding. Some might call it lying if they were not observing and describing, mm-hmm. but in some way, the communication is not being really clear about what's going on with the member. Yeah. It's really hard to know. I'll see the pattern and I'll ask parents, so how long have they been using? And the parents will be like, oh, my kid doesn't use. Right. Oh, okay. How do you know? Yeah. Oh, because they're always in their room. Yeah. Okay. So not to discount the family, but that first piece is observing and describing and helping them see, non-judgmentally, not in a way that would cause more fear than there is, but just helping them notice the pattern. Right. And once they've noticed the pattern and they're in a non-judgmental environment, like this isn't about being a good enough person. Right. This is what the family's dealing with. Yeah. Then it's easier for them to see where they are now and where their healthy family functions, which is usually that image they have of themselves. So if you ask the family, what are you like? They'll give you this image and you're like, white picket fence, yeah. It used to be like that. Yeah, right. And now it's a little different. Right. Yeah. So once they can identify what's happening, then they can start getting a picture of where they're going. Mm-hmm. Right. And so by the time you guys have it, they're starting to understand where they are versus where they want to be and versus where they can be given the way the family shifted them.
Yeah.
You can never go back.
It's interesting that so when I used to work in admissions and, you're taking somebody through their use history, just as an example, we're always trained to say, take that with a grain of salt. It's probably a little bit more. You say you're drinking a couple drinks on the weekend, but you're coming to Sabino for your addiction issues. It's probably a little bit more. So that sounds like the family version of that hiding, right? Or underreporting. So, it can take sounds like it can take a keen eye or a keen ear to kind of really understand what's going on.
Yeah. And I think a big part of that is increasing the safety, because when people come to us, they're feeling failed. And if you ask them about their history, they give you a history of feeling failed and of being failed. And so what I like to do is start with the competence, like the connection, like what makes you a family. Sometimes we'll do a Pictionary, like a picture of the family's greatest strength, a picture of the family's greatest challenge. Because I want them, without language, to be able to see, why are we a family?
Mm-hmm.
And what are we going to?
Yeah.
It's not about having little mini-me's.
Right.
It's just about we are a family with warts and bumps and the whole 9 yards.
So some families have maybe more warts and bumps than others. So there's probably different approaches or types of therapy that are better suited for different families or different family systems. And I know that you are going to be giving a talk at an event coming up here later this week. So I wanted to give you a chance to kind of address that part of it and kind of give us a little sneak preview of what that talk's going to be like.
Yeah, I'd love to. Anytime you're delivering difficult news to people, or you're seeing patterns, or they're frightened, we move from connection and affiliation to power and control.
Okay.
Right? So in therapy, you want to move people from their power and control place to connection and affiliation, because you're never going to win a power struggle.
Right.
And humans are pre-wired to connect.
Yeah.
Right? So one of the things that we might get is a high conflict family. And that family because they are arguing and they're talking over each other and they're stomping out of the room and whatnot. So when somebody is experiencing their loved one's situation or their situation in that way, the first thing we want to do is quiet the room, because the louder it is, the less likely anybody is to hear.
Mm-hmm.
And it's generally out of fear. And our job is to switch it so that we can go from an either or to a both and.
Okay.
Either you're right or I'm right, or we're both right.
Right.
Like the system's not working.
Yeah.
You want it to be how it was, and it's not. So really accepting the grief. But the louder the people are, the more you know what's going on for them. So I think sometimes clinicians will allow people to just fight in their room. But what happens is it makes it unsafe for some of the members,
mm-hmm.
right? So you really, once somebody's become vulnerable, you really want to make it safe. So your early steps in a conflict habituated family is to really quiet the room down, again, very structurally working in the room to allow people to learn the skills they need to not be afraid. And sometimes, I was going to make a real judgment there. Maybe this is not true, but it seems like men have a harder time admitting fear.
I'd say that's definitely true. I think it's probably gotten a little bit better, but it's still probably, compared to women, definitely true.
Right. Yeah, thank you.
Yeah, of course.
Yeah, and so you've got that real big bravado,
yeah.
and there's that temptation for them to take up lots of space in the room.
Mm-hmm.
And the job is to help them tolerate not being the most
right.
present person in the room. And once they start not being as loud, the fear starts coming up, and the thing they're most afraid of comes up, and the grief comes up.
Mm-hmm.
So with high conflict families, again, it's going to be to quiet the room, to move from power and control to connection and affiliation, and to give them skills immediately, because you're taking away their primary strategy, which is to be mad.
So one thing I heard you say was that sometimes a clinician will allow them to fight from the onset, just to kind of get a better idea of what's going on. But if I'm hearing you correctly, that's not necessarily what your approach would be, because it sounds like whether or not the clinician allows it to happen, it all kind of comes out in the wash eventually.
Yeah, so be really aware that it's okay to shuffle clients. So if one person just can't not be highly conflicted, then you can work with that one person until they get enough skills to be in the group.
Okay, I understand.
Right, but you don't want to oppress any one member of the group.
Right.
Right? And the person possibly with the addiction may be the least able person to really speak their mind.
Mm-hmm.
They might depend heavily on the substances to speak for them, because once they're out, they're out.
Right.
Right?
Right.
So really making sure that people are heard the way they need to be heard, and that you're working with that dialectic that the louder you are, the least I hear.
Right. Okay.
You know?
Gotcha.
Yeah, so the other thing that happens is invalidating systems. Oh, it's not that bad. And you do get that a lot.
Mm-hmm.
Like, no, I had one parent tell me, you know what? She keeps saying that she's on drugs, but she's not.
Is that because there's a certain amount of like shame from the parent, as like, well, this is a human being that I raise, and if I admit that they're, you know, in this situation, then it reflects poorly on me? Is that part of what takes place there?
I think it could be. And I also think sometimes people are not accustomed to listening to their family members and hearing them.
Right.
Right. So somebody will say, I'm hungry, and somebody will say, well, you just ate.
Right.
That doesn't change whether
I'm still hungry. Yeah.
Yeah. And so really looking at, sometimes I think with invalidation, it's a lack of skill, or it's fear that if I hear something I don't want, I don't know how to manage my own experience with that.
Right.
So I'm going to force my will on you.
Gotcha.
Because I know how to deal with that.
Yeah.
And sometimes if I can be invalidating enough and start a fight, I know how to do fighting.
Yeah.
I don't know how to do sad.
Let's take it into my arena, the fighting arena. Yeah. Yeah.
Right. So they're like taking a football to a baseball diamond.
Yeah.
Right? And you're like, no.
Still going to lose that game.
Got to choose which game you're playing.
Yeah.
So with validating, it's really teaching people to look at each other when you're talking. I think, positive overriding sentiment is probably the most important thing in that situation. Like, I can't invalidate you if I look directly in your eyes.
Right. Yeah.
And if I hear you saying, I'm hurting, I really can't say, no, you're not. The education part is somebody needs to teach me what to say when I can't do anything and I'm a fixer.
Yeah. So that's conflict style of like family. What are there any others that are pretty common?
Other is the problem saturated family.
Okay.
And that's a family when they come in, they have a list of everything that's gone wrong. And you'll hear them saying, well, and then this happened, and then they didn't come over, like they did the dishes, but they left, a bunch of water on the sink. And so it's just like on and on and on, problems saturated. The other side of unrelenting crisis is inhibited grief.
Okay.
So anytime we're hearing like on and on and on about all the problems, and people do have financial problems, people have health problems. If you have a place to live, you have problems fixing it. If you don't have a place to live, you have other problems. Like, problems are part of being alive, right? And sometimes people spend so much time solving the problems that they forget to look at what's causing all of these problems to pop up.
Right.
So the minute you start hearing tons and tons of problems, you start looking for what's the theme, right? Like, if you look at how women process panic, and again, a lot of this stuff is ambiguous loss. Like, we don't know what's happening. So women experiencing themselves as panicking, they'll start tending and mending. They'll start seeing everything in great detail. And that's like, moms will like start picking lint off their kids' clothes and, dusting and all that kind of stuff, right?
Yeah.
So
that's interesting because, like, when you talk about like when somebody really hones in on each specific problem, it almost seems like when they do that, they're ignoring like the big problem. Like,
Yeah,
you know what I mean? It's just kind of like a coping mechanism for that person almost.
Yeah, and they don't realize they're ignoring the problem. And I think that's the harder piece, is you don't realize that you're ignoring it.
Right.
But what we see as a symptom is unrelenting crisis.
Mm-hmm.
We see each thing being noticed, being a problem. And what it does is it takes the people's attention to each of these things. So, their house might be on fire, but they're watering their flowers.
Right. So it stops them or gets in the way of them getting to that point where they can like grieve what the actual problem is.
Right.
Got it.
See it and grieve it. So as long as they're staying busy,
right,
then they don't have to see what they're dealing with. So most of therapy is not problem solving for people. It's helping them set up the problem.
Mm-hmm.
Right. So if you think back to math class, if somebody gave you an equation, you'd solve it. But if somebody gave you a story problem, that's usually harder for
right.
kids.
Yeah.
Right? And therapy is like somebody comes in with a story problem. They come in with a proposition of what's going on, but we listen for the patterns, and I listen for, are you counter complaining? Are you bickering? Are you, those kind of things? Or are you turning completely away from them and not even paying attention? Or are you just coming up with your own list?
Yeah.
Right? So you listen for that pattern as they give you the proposition. You hand them back what they think is happening, plus what the change agent is.
I really like that analogy to a word problem in math, because there's always a few sentences in there that are irrelevant. They're just kind of thrown in there to throw you off. It's like, is this important or is it not important, right? So all of that oversaturation is that 2 or 3 sentences in that word problem, talking about math class, that doesn't matter. It's not the root of the problem. It's just kind of like background noise almost. Yeah.
Exactly.
Yeah.
Exactly. Yeah. I was just working with a couple, and it had that essence of just the total list of what was going wrong. And the bottom line is, for this couple, is there's an addiction.
Mm-hmm.
And the person with the addiction doesn't know if they want to recover or if they want to go into treatment or whatever. And the person without the addiction wants to go back to what the marital rules were, right?
Right.
We have this sober household.
Mm-hmm.
And so all of this stuff gets thrown in there. And the problem is, do you want to recover? And do you want to be in a situation where you're always looking over your shoulder
Right.
about whether your member's recovered?
Mm-hmm.
Right. And we all know there's going to be the commitment for the person addicted, if they are or not, and they have to choose.
Yeah.
And the family has to decide, are you in it for the long haul?
Yeah.
And that means no blaming, no shaming. Like, you're taking on the responsibility for your own emotional safety.
Right.
You're not having vulnerabilities that aren't wise at this point.
So your job as a therapist in that situation is just to get them to that point where it's like, actually, this is the only problem. The dishes, the lying, whatever. Like, we understand we're not okay with that. But the root of the problem is, are you willing to get better? And are you willing to be in this for the long haul and accept this person?
Yeah.
Yeah. And that's when it gets real. That's when
you give them phone numbers. Yeah. You have the pamphlets, and you're like, here are your choices.
Yeah. Yeah.
Yeah.
Yeah.
And, to the family's credit, the family therapist is their first step, right?
Mm-hmm.
And so, like, they come in. Well, actually, the physician is their first step. Get a lot of referrals from PCPs who don't know what to do. Some family friends, that kind of thing. And they come in, and they're both scared and upset, and they want help. And so always going for that connection. Like, people don't come into therapy because they didn't have a better way to spend a couple $100. Right. And so we really want to appreciate, sometimes people will blame families, or they'll blame the system, or they'll blame the addict. There's no blame here. This is life. Like, you don't blame people for having a heart attack.
Right.
You don't blame people for becoming diabetic.
Yeah.
So you don't blame people for having their reaction.
Yeah. So in a past relationship, I did couples therapy, and it was so it was, because you see it in like pop culture and movies and stuff where it's like super conflict oriented and it's like, who's going to be right, who's going to be wrong, but just getting them to a place. And we eventually got there where it was like, we're here because we need help and we want, it's not about pointing fingers. It's about how can we move forward. And I think probably a large part of your skill as a family therapist is just getting past that. We're coming here to figure out who's right and who's wrong, to like, no, we're actually in this together and we need help. Where do we go from here is probably the hardest. And once you get there, then it's going to sink or swim, and for better or worse. But until you get to that point where it's, we have the right motives for why we're here, we're on the same page, until you get there, there's really not a lot that can be done, it sounds like.
Yeah, and so really focusing on that connection first. Whoever walks in the door, it's the connection. Like, why are you a couple? What do you want? Like, what's your goal ahead? Because the solution to the problem doesn't look like the problem.
Mm-hmm.
And as soon as we get that view changed, then even if it is addiction and control and that sort of thing, we're going for the connection. We're not going for the power struggle.
Right. Yeah.
And when you're in an interdependent relationship, you will do things that you would not have done ordinarily because doing them makes your partner's life easier.
Right. Yeah.
So.
Yeah. So we got conflict, we got problem saturated, and what's the other one? Invalidating. Okay.
And I think invalidating as a culture, as a white Anglo culture, I think that is one of our hardest pieces. And so I can't speak for all of the other cultures, although I tend to see it in families from all different corners, that we know what we want our children to do and we want our spouses to do and what we believe is right. And when they tell us something that's different, we want to tell them that they're wrong. Mm-hmm. So we want them to feel good, and they tell us they don't feel well. We're like, oh, I think you're fine.
Right. Yeah.
They scrape their knee. Oh, you didn't get hurt. Mm-hmm. Like that kind of thing. Mm-hmm. And it translates into relationships where I'm trying to tell you I'm struggling, and you're telling me that everybody at that age struggles. And I'm like, no, it's a different kind of a struggle. So what you get is then an inaccurate communication because I have to really blow up what I'm saying, blow it out of proportion to get your attention.
Right.
Right? And so that's probably the easiest one to fix, and it's the hardest one to notice.
Right.
Right? And so again, just like looking in each other's eyes, validating them, and then dealing with what comes up in you because that's their truth.
So I was talking, it's so funny that we're doing this today because last night I was talking to a friend about him and his relationship with his girlfriend and where they were like disconnecting. I was trying to help him, and he was saying, she's coming to me with these problems where, it seems like she's, kind of acting impulsively and, making decisions based off of emotion. And I'm over here, telling her logically how to solve these problems. And I heard somewhere, and I don't want to, the same way you were hesitant to say that men were, I forget exactly what it was, but men are big in the room, don't admit fear. I hesitate to bring this up too, but it's something I've heard a couple times where men are just hardwired to be more logical, right, in the way they approach things, where women, I don't know what the right word is just react a little bit more based off of like emotional minded. Yeah. So I imagine that's kind of a tough bridge to gap in your therapy sometimes. And I wanted to know if maybe you want to speak on that a little bit.
Yeah, I mean, really good point. So that in everything we're looking at culture, right? And now your men's and women's culture. And we're looking at some of the biology there too, right? Mm-hmm. So men tend to go A to Z. And if you think hunter-gatherer, they're taught to go out, get the food, and come back, right? And so that's a very, primitive way to think about it. But we think about how you're wired. So John Gottman looked at how women and men fight, hooked them up to galvanic skin response, heart monitor, all kinds of things, had them argue. And what they found is that men flood very quickly. So all a woman has to do is say, I want to talk to you, and boom, they flood it.
Mm-hmm.
And it actually physiologically starts shutting them down to fight, flight, or freeze.
For men or for women?
For men.
Okay, gotcha.
Right. So when men hear something,
Yeah.
they try to problem solve it.
So that doesn't get to that point where they have to go there. Yeah.
Or that is their panic response,
yeah.
right? They're fleeing. Like, okay, do this.
This is ringing very true. I can almost feel it already. I'm just kidding. But
No, it's very true. And you
Yeah.
can see it happening in the room.
Yeah.
Now, if you think about how women have been taught to do things, they tend and mend to kind of form a circle, and they think about things over and over and over. And if you think about like a horse in an arena being trained,
Mm-hmm.
they will do the big circles, but they will do small circles. Each time they kind of get stuck,
Mm-hmm.
the trainer will pull them in small circles to get that corrected,
Okay.
that speed corrected.
Yeah.
So women try to do that with their partners. Now, women, when they panic, they go into shallow breathing. So they can panic and come back, panic and come back. Very much like the sexual response cycle,
Mm-hmm.
right?
Got it.
The orgasm experience for women and men come out in the fighting.
Interesting.
Yeah. So with women, they will chew on things for a really long time. They will bring it back to their partner. It doesn't mean they're looking for a solution. Their mind is still wrapping around it.
Mm-hmm.
Men will hear it. It will raise their anxiety. They're like, here's a solution, go.
Yeah.
But women are like, yeah, but.
Mm-hmm.
Well, what about this? So what I try, well, first it's psychoeducation, that people have to learn that women and men, as much as they try to understand their partners, they're still biologically the woman or the man. Now,
Right.
understand, even as I'm saying this, I'm like, I know there's an LGBTQ plus whole arena. So I want to clarify that I'm talking about biologically. If you look at kind of graphs, there are outliers, there are middle parts. So I want to acknowledge that.
Sure. No, we're just
differences.
talking more general
So
sense.
This is very general.
Yeah.
Cis men, cis women, and how they would be responding.
Mm-hmm.
And I would expect in my office, if a woman has a complaint, I will see the man's face flush. I will see the muscles tighten. They'll hold their breath. And right then I know that they're going into flooding, and I will have to do some soothing work, get them to soothe with their senses, do some breathing, stay present, and become accustomed to they don't have to solve it right now.
Right.
It doesn't mean they won't feel the urgency to solve it,
Yeah.
but it means we know we need to kick into soothing.
Right.
For the woman, oftentimes we have to talk about, as much as you want to talk with your partner, you can't hand him anxious things and then expect him to just let it be.
Right.
Because he's not hardwired that way.
Right.
And so for women, they have to say to their partner, I don't want a solution, and I'm in the middle stages of mulling this.
Yeah. Communication.
Yeah.
Yeah. That's the biggest part.
See whether, and then the partner can say whether he can or cannot do that at the time.
Mm-hmm.
But yeah.
Yeah, that's very interesting. I'm glad I asked that question. Learned a lot right there. Yeah. And I'm telling you, like, you know, my past experience doing couples therapy, I was like, ooh, I can feel that feeling of like just being anxious and wanting to solve it real quick. Like it took me right back there. It's just like, she's so right. Yeah. No, that was very interesting. So are there any other types of families that maybe are part of your talk for the speech that you're going to be doing?
This is the major part of the talk. I didn't cover the really well-functioning typical families. By the time people come in to therapy, usually their fear is taking over. And so we're seeing some of the results of that power and control spectrum. Your healthy families, we always want to have people have an idea of what they're doing when they're healthy so that they can keep doing it, right? Mm-hmm. So one of the things that we know is that people forget to have fun together, right? And so then there's some of the, traditional information about have dinner together, have a meal together. People will say, well, we can't have dinner together because of our work schedules. Americans tend to eat 3 times a day.
Yeah.
If you don't have one of those times for your family, you're probably too busy.
Right.
right? People have to play together, right? Without being entertained. So play together doesn't mean going to the movies. You're being entertained and you're being co-entertained, right? So when you look at those things that are going to be soothing for families, like sitting down and talking and making eye contact, moving into a place where you don't have to be right. It can be both and rather than either or.
Right.
So people can be free to be vulnerable and to be chatting with each other. Those are the things that carry people through the difficult times. So there's the overriding sentiment in families that makes a big difference. If you have somebody who looks at what their partners or their family members do and say they meant well and this is just a blip, those families are going to get through crisis much more easily than the families who look at their partners and say they meant to do this.
Right.
So like an example, if, a husband goes out and washes his wife's car. In a satisfied marriage, there'd be positive overriding sentiment, and she would say, "Isn't that sweet? He just washed my car." In an unhappy relationship, there'd be negative overriding sentiment, and she would say, "Can you believe he'd rather wash my car than even talk to me?"
What I was thinking is like, oh, he's probably just making up for that remark he said yesterday.
I hear that all the time.
You know what I mean? Like, his motives weren't pure or loving. He was trying to make up for something. Yeah.
Which has been, the complaint about couples behavioral therapy. You'll hear that a lot, that people will do something, they'll say, well, you did it because the therapist told you to.
Right.
So it just means that there's a little work to do before you get into the couples behavioral therapy to make that connection, to get people looking at each other in the eyes, knowing why they're together. So a lot of times I'll tell people, go out on dates that don't cost anything, that you have to talk to each other. Don't talk about any problems, right? Treat each other like you would a neighbor you want to get to know.
Yeah. Yeah, and that can be hard for people to do when they've been dating for 4, 5, 6 years, but it can kind of feel weird, but I think it's something that's so important because you can never stop learning about your partner and, spending good quality time like that. Because people do think going to the movies is like a good date. It's not. It's just not. Like you're watching a movie by yourself almost.
Yeah. So it's a good other thing to do.
Yeah.
Right?
Yeah.
There's a couple who are in the marriage enrichment area, and they have a program called 10 Great Dates.
Oh, cool.
And you can still get their book. And it's really helpful because it gives you like what to do and what questions to go over. Families can do that really easily, right? And anytime you've got that connection in family, you really enjoy each other, you appreciate each other, you think the best of each other, you can get through these other places. Sometimes people will say, oh, but he lies. I can't do that because he's lying all the time. So I can't trust him. And what I like people to consider is you can trust him to not tell the truth. It's absolutely what you can trust.
Right.
So then you don't have that as an expectation in the relationship.
Yeah.
Right? So you're taking that. If you think about it, it's so simple. But now I'm not going to do 10 questions with you. I know what I know. I know where I can put my vulnerabilities. Like if I tell you I need you to take out the garbage and you say you're going to take out the garbage, but you never do. It's my fault after the second.
Right. Yeah.
Right?
Yeah.
So I'm now with somebody who won't take out the garbage. You just need to know that.
Yeah.
Maybe there's some other talent you have.
Yeah. That's funny. So you're kind of like doing a little inception on your own mind. It's like, well, actually, I can trust you, just not to do what I want you to do.
Right. And then that's such important information.
Yeah.
You do that really early with the families because they'll be like, I can't trust them. They took out the car and they didn't bring it back. I can't trust them. And I would say, so what was the consequence? Well, I told them to come back earlier next time. I'm like, they don't come back. How is that a solution, right?
Right.
And so you really want people to think, like, if you have an expectation that the car comes back and this person has not been able to accomplish that goal.
Yeah, it's your fault.
Yeah, don't give them
You can't expect them to do it. Do the right thing, yeah.
Yeah, and it's not even the right thing.
Right, yeah.
It's just, that's not part of this arrangement, right? Well, the only time I know they're doing the right thing is when I'm seeing them. Perfect. then you just bond more.
You're grounded.
Well, and I don't even believe in grounding.
Well, no, I just mean that's how you're going to see them all the time, right?
Yeah.
You're going to be at the house.
Yeah, and with people who are starting to, make mistakes and stuff, you're like, bond more.
Yeah.
Go do things together. Well, they don't want to do things with their dad. That's the consequence of doing the wrong thing.
Right. Yeah.
You got to enjoy your dad.
Yeah.
Right? So the worst thing that'll happen is they'll have fun together.
Well, I'm glad you mentioned doing fun things together, both as couples and as families. So that's another component of our family program is that last day, the loved one or the family takes them offsite to go do something fun. Mm-hmm. And at that point, they've been here for 35 or actually 4th week. So, 4 weeks or so. And maybe before they came to treatment, they wouldn't have liked going out with their mom and dad and sister. Yeah. But after being here, not that it's horrible to be here, obviously, but they miss that. So they're more kind of engaged, and it's a good kind of jumping board for them to do more stuff like that when they get home, hopefully.
Absolutely. Yeah. And what a better place. I mean, Arizona, being able to be in the mountains like we are, and there's just even taking a short hike. You're right next to Sabino Canyon. Yeah. There's just so much to do right in this neck of the woods, and it's all peaceful. Yeah.
No, and every time we have a new guest who comes here, I know you've been here a few times before, but, taking people on tours, they say the same thing. And I'm here all the time, so sometimes I take it for granted. So every time I hear it again, I'm just like, you're right. Like, this is such an amazing place. And thank you for that glowing.
Absolutely. It's
appreciate
beautiful. That. I love the experience people get here. I've had a lot of clients who've been referred here, and they've had a really good experience. Yeah. So I think you guys are doing a really great job.
Well, thank you, Vicki. And again, thank you so much for joining us today. I think this is one of our best topics and one of our best guests here on the podcast. So thanks so much for coming by.
Yes, you're welcome.
And to our listeners, thank you for listening to A Wise Mind podcast presented by Sabino Recovery. To listen to more episodes, just search A Wise Mind presented by Sabino Recovery in your chosen podcast platform. We discuss topics that can be difficult to process on A Wise Mind. There is no shame in seeking help. For resources or to find someone to talk to, please visit the links in the description below.